chronic migraines. Do you know there is an FDA approved solution for this? Effective for 3 long years? Yes. You heard that right. There is an FDA approved Botox for chronic migraines that is helpful for 3 long years. In this video, I will share all the clinical trials that have been conducted to measure the effectiveness of Botox for chronic migraines. But before diving into it, don't forget to watch my other How to Cure Chronic Migraine Using Botox. It will be helpful for you to make a good decision. Now let's see what science says. Several clinical trials have been conducted to assess the effectiveness of Botox Onabotulinumtoxin for the treatment of chronic migraines. Below are some key details about the major clinical trials. 1. Preempt trials. The Preempt trials Preempt 1 and Preempt 2 are the largest and most significant studies that evaluated the use of Botox to prevent chronic migraines. Preempt trial design. Participants. Over 1,300 adults with chronic migraines, defined as 15 or more headache days per month, with at least 8 of those days involving migraines. Method. Participants were randomized to receive either Botox injections or a placebo. Botox was administered in 31 injection sites across the head and neck. Duration. Each trial lasted 24 weeks. During this time, patients received rounds of injections. Results. Botox significantly reduced the number of headache days per month. On average, patients receiving Botox experienced 7 to 9 fewer headache days per month. Patients reported improvement in quality of life and a reduction in disability caused by migraines. Botox was generally well tolerated. The most common side effects were neck pain and muscle weakness, but these were generally mild and temporary. Conclusion: the Preempt trials demonstrated that Botox was an effective and well-tolerated treatment for reducing the frequency and severity of chronic migraines. Based on these results, Botox was approved by the FDA for the prevention of chronic migraines. 2. Other notable trials and studies. Several smaller clinical trials and follow-up studies have also been conducted, supporting the findings of the Preempt trials and further confirming the long-term effectiveness of Botox in chronic migraine prevention. Long-term studies. Follow-up studies showed that Botox remained effective for chronic migraine prevention over longer periods up to 2 years in some studies. Cost-effectiveness. Some studies have explored the cost-effectiveness of Botox for chronic migraine, that it can be a viable option for reducing the overall burden of missed workdays and medical visits. Conclusion: the clinical evidence from the Preempt trials and subsequent studies firmly establishes Botox as an effective preventive treatment for chronic migraines. Also, reduces the frequency of headaches and improves the overall quality of life. Thank you for watching this video.